I am Didi. I am a respiratory therapist, a registered respiratory therapist. I have worked here since June of 2013. I came here from a big hospital in Terre Haute. Worked up there when I got out of school, and I live in Carlisle, so I wanted to drive that was closer to home. So I saw the newspaper, and there's a job in there, so I applied and got it. So I do sleep studies here, and then I am a floor therapist. Do sleep studies twice a week, and then a floor therapist once a night a week. And then, but there's 3 of us, and so we rotate. But I normally do most of the sleeps. So,
what are some of the challenges of your position?
When I'm a sleep tech, it's keeping the patients happy and keeping the leads all on them. And then on the floors, it's just getting everything done, since I'm the only therapist here on nights, being where I need to be when people are wanted.
Tell me, what are some of the rewards of your position?
I guess when you walk in and you see people that can't breathe very well, and then you give them the breathing treatment, and then they can breathe a little easier and just look easy, happy, or eat at ease. I guess when you can't breathe, you're pretty anxious. So just helping people. I mean, I really enjoy helping people. So
what's the difference between working in a large facility and then working in a smaller facility like we have?
I feel like we're all family down here. I know nurses' names here. I didn't know any nurses' names in Terre Haute, and I worked up there for many years. But here, you just you know everybody. You just kind of know what their kids are doing, and what their husbands are doing, what vacations are going on, and we all just kind of talk and have fun. So,
do you have anything that you remember, a special patient or a special story that you'd like to share?
A couple years when I first started here, Camby Smith and I was getting a report from her, and we had to go do something, so we did it together before she left. And we were walking back to the department to finish report, and a little dementia lady was sitting in the hallway in a jerry chair, and she yelled out "poopy pants," and so Camby and I take turns making fun of who the poopy pants that she was referring to, but Camby normally says it's me.
Well, thank you, Miss Poopy Pants.
Thank you.
My name's Crystal, and I work in patient access. I register the patients, and I also recently started pre-registering and prior authorizing their testing to be done here. I have been here for 5 years, going on 6 in May, and I really enjoy what I do.
Great. Tell me about what your job responsibilities are.
Job responsibilities are registering the patients, getting their information, updated information, making sure we have their orders when they come in for the test, getting the input through Medicare if they have Medicare, and making sure they have everything they need to get their testing done. I also call and pre-register patients before time for their scheduled test, so that way the process is shorter when they come in the door. I also recently started doing prior authorizations for testing done here to make sure their insurance is going to pay for it when they come in.
Tell me about what are some of the challenges of your job.
Challenges would be not knowing what I'm going to be in store for when the patient gets to my desk. Sometimes they can be fine and happy, other days they can be very upset or mad or just angry at the whole process. It's pretty much just knowing that I stay the same, trying to make them happy. Some people I work more, have to work towards pleasing them more to get them on the relaxed mode and ready for their testing and be happy that they did choose here to come. That's about the big one, is just not knowing who I'm getting and what kind of mood they're in. But I want to always make sure I'm happy and try to get their mood to where they're relaxed and comfortable and glad they came here.
Okay. Tell me about the rewards of your job.
The rewards is pretty much just knowing that I can lighten their mood up to where they're not so grumpy or angry or upset, because some people are here for testing that isn't going to come out good sometimes, and it's just kind of putting myself in their shoes on how I would want to be treated. Even if I don't feel good and I'm grumpy, I would want somebody to be nice to me even though I might not be. I've been in that position where the guy has been very angry And I just tell him, you know, I'm sorry, I'm just trying to get your process done so you can get your testing and get home. And then he apologized because he realized he was kind of grumpy, but he realized that I was being nice back, and he apologized for that. And there was this one guy, he always came to me, only me, because he felt relaxed and was happy, and he always complimented on my smile. And he just was one of those that he cussed like a sailor, but talked about going to church. And he was always fun to have. And he would always just wait outside my cubicle, and now he has passed away. But I always think of him when I talk about my patients because he was always fun to have. He always left me smiling.
I'm Dale, and I am the assistant practice manager over the MSO clinics. And I started with Sullivan Family Practice in the fall of 1995, which has been forever ago. And when I first started, Dr. Dupree and Dr. Borghaser had just become partners in Dr. Conwell, and they merged their clinic, and I worked in charge entry, and I was Dr. Conwell's receptionist for many years, and then I just went to charge entry, and I helped the practice manager at that time as well when she was out or on vacation or anything like that. But now I am the assistant practice manager, and I do whatever Sam tells me.
So can you tell me, what are some of the challenges for you helping to manage the clinics?
Time is a big challenge, and also working with 40 different personalities of women sometimes can be a challenge, and trying to fix everything, and on-call calendars and schedules and stuff like that. When everybody wants the same time off, it's really hard for me to tell somebody they can't have the day or the vacation that they want off. I wished I could give everybody, because everybody deserves their time off to themselves, and it's really hard for me to tell them that they can't. But working with all those women is kind of hard sometimes.
But you told me that it's like a family atmosphere for you, right?
Yes, it is, because I feel like everybody wants to cover for everybody. You know, they're really good about volunteering. Oh, I will cover that day, you know, because my provider's not here and she needs to go do such and such with her family. So, you know, they're really good about covering for each other if they need a long lunch or something like that. They're very, very good about helping out each other, which makes my job easy because I don't have to go tell somebody, hey, you need to cover for her, when it's something they can take care of themselves.
Okay.
So that's very nice.
Do you have a special story or an experience that has happened at work that you found was very rewarding or very touching?
About 10 years ago, Dr. Conwell and I worked really close with the Red Cross. He had a young mother who wasn't taking very good care of her infant child. It was probably about 3 months old. And the dad was in Iraq, and we made numerous calls, probably over a 2.5-week period, and wrote numerous letters and faxed them to the Red Cross to try to get him home so that he could take custody of the child, so that he would get the care that he needed that he wasn't getting from the mother. And it was really stressful. I thought about it all the time for those 2 weeks because, you know, I just wanted to go get the baby and take care of it myself until he could get here. And he even called me numerous times from Iraq, you know, telling me what I needed to do, you know, to help him. And Dr. Conwell was really good about signing any letters or any papers that the Red Cross needed to get him home. And the dad still will send me pictures of the child because the dad did get to come home, got custody of the child. And for a lot of times, every child visit he had with the child, he would ask for me. Then I would get to go out and hold the baby and stuff like that. So it was really nice. It's nice to see, you know, I'm not a clinical person, so I don't interact a ton with the patients unless they're angry. So it was nice to be able to actually help somebody. I felt like, you know, we made a difference in this child.